How can healthcare system obtain a culturally sensitive care for transgender patients? Good afternoon, ladies and gentlemen. My name is Azadeh Foruzadeh, and the topic of my project is that healthcare staff must receive a trans-inclusive training to become culturally competent for transgender patients. The reason I picked this topic is that the transgender population faces numerous barriers in healthcare system. This can cause by lack of knowledge or biases of healthcare professionals, and they result in underutilization of healthcare system for this population. According to a survey report from National Transgender Discrimination Center, 61% of transgender patients avoid medical care because of the fear of discrimination. The consequences of this inadequate medical care are shocking. 54% of transgender youth have attempted suicide, and more than 50% of transgender people are injecting hormones outside of the conventional medical setting. Lack of education and absence of guidelines for healthcare staff can prevent healthcare staff from providing a compassionate and competent care for transgender population. So in order to obtain a culturally competent care for transgender people, healthcare staff must receive a trans-inclusive training in their modules. The goal of my project was to provide a transgender specific training for ultrasound technicians, and this also I wanted to emphasize on the importance of the transgender specific training on whole healthcare staff by asking the trainees to fill out the pre-training and post-training surveys. The educational session took place at the end of one of the staff meetings for ultrasound technicians, and unfortunately, because of the COVID situation, not more than 7 people could attend this meeting. But this session was really successful. Educational component. I started creating sense of urgency by including some statistics and facts about the consequences of culturally incompetent healthcare. And also I talked about the stages of gender identity and the difference between gender identity and sexual orientation, and how trans people begin transitions and how we can provide a competent and compassionate care to them. I also talked about the pelvic ultrasound for transgender people, who can be a very traumatic experience for them, and also some do's and don'ts, how can ultrasound tech make this traumatic experience more comfortable for them. Also, at the end, I talked about some health risks of hormone therapy. Why did I choose ultrasound department? Because ultrasound department deals with pelvic organs. Ultrasound technicians do transvaginal ultrasound and transrectal ultrasound. And this is very important for them to be aware and not to make any assumption about the patient's anatomy due to the patient's gender presentation. So if there is a transvaginal ultrasound on a trans male who still has ovaries and uterus, or a transrectal ultrasound on a trans female who still has prostate, so the most important thing is that the ultrasound technicians should not make any assumptions of the patient's anatomy based on the patient's gender orientation, and also make this experience more comfortable for them. It is important for an ultrasound technician to be aware of having a gender affirming approach, and which for the transgender patient. The work that has been done before, most hospitals provide a training module instead of a non-technical training module regarding the anti-discriminatory policies of LGBTQ patients. What I want to focus is that there is a need for separate training module for transgender patients, because transgender patients go through a different path. They go through hormone therapy, sex reassignment surgery, transitions, and healthcare staff must be educated differently, comparing with putting the transgender module with whole LGBTQ module. The pre-training surveys were distributed online, and they filled it anonymously, and 9 people filled this pre-training survey, and all of them admitted that they had a transgender patient before. About 11%, which can be 1 of 9, said that they think that dealing with the transgender patient can be more confusing comparing to other patients. Also, about 90% of the people said that transvaginal ultrasound, they agreed that can induce a lot of anxiety to the trans people. And 22 people mentioned that they had this experience that they might have make a transgender patients feel uncomfortable. And about 66% mentioned that they think they need to learn more about transgender patients, and they think that transgender people might feel discrimination in a healthcare environment. But 90%, almost 90% mentioned that hospital staff needs guidelines and training about how to make a transgender patients feel more comfortable in hospital environment. Post-training surveys, just 7 people attended the training, so 7 people filled it, and all of them agreed that more work needs to be done comparing to what the hospital is doing right now. And training session, all agreed that their training session was successful, and they need updated knowledge in this area, and all agreed that they need hospital staff need contextualized training, ongoing contextualized training regarding transgender patients. For the discussion, I have this explanation first, that the samples were very small, as 7 post-training sample survey or 9 people pre-training survey are a very small samples to make a discussion for. I would want to make this bigger sample bigger, like I would want to have it for all ultrasound departments in multiple hospitals, or all diagnostic imaging staff, and so the sample would be at least 100 people. But with this small sample, that is a beginning of the job, I can say that comparing the pre-training surveys and post-training surveys, I can say the current training module of LGBTQ that hospitals are all providing to the staff is not enough. And there is a need for a separate training for transgender specific training, that hospital staff needs to be educated better regarding this case. And as a healthcare provider, it is crucial to be respectful of the diversity, and to be able to provide sensitive care to all of the patients. And also in a survey in South Africa, nurses indicated that they never received proper training regarding the transgender patients. Also, as I mentioned before, the post-training surveys, all the techs agreed that these jobs that hospitals doing is not enough, and more jobs need to be done, and they need to receive separate training regarding transgender patients. So all of this together, I want to talk about the things that helped me in this project. So intercultural health communication was a class that helped me to understand the importance of cultural competency in healthcare environment, and how it can be catastrophic if the cultural staff are not really culturally competent. And also biomedical ethics, that I learned a lot about the ethical principles, such as non-maleficence. Non-maleficence means do not harm, and we need to know that even by being culturally incompetent, we can harm our patients. So we need to provide this knowledge to our staff so we don't harm our patients. And also my other resources were Bellevue College Library Media Center, and also I had some interviews with trans male and trans female people to have some perspectives. And in conclusion, I want to say that in order to eliminate barriers for transgender people, we need to create a welcoming environment for this. And this cannot be possible by, one of the ways to make it is that by providing a trans-inclusive training for all healthcare staff. I want to thank you, Professor Jennifer Perkages, for all of her support and direction, and the lead of ultrasound, Stacy Buck, for giving me the opportunity for having this training session. Writing specialist, Thomas Donahue, my parents, sister and brother, my beloved daughter, Mava, and my boyfriend, Dan, for their care and support. These two stood by me all through, with patience and tolerance. My word of thanks cannot tolerate their contribution. Thank you. And these are my references. I am ready to answer all your questions. Have a